Hello everyone. Today I'm going to give you some tips on OET speaking subtests. Let's begin. In tip number one, we talk about intelligibility. When I say intelligibility, we make sure the patient understands and follows us easily. You can use these structures. For instance, tell me if you have had any issues following the diet that we discussed at your last appointment. And here you see the paraphrased version of this structure. Tell me if you encountered any difficulties adhering to the eating plan we discussed at your previous session. And then we wait and we let the patient speak. Tip number two, fluency. First, we need to address your diet. Then we'll look at more invasive treatments. Of course, we pay attention to fluency, but in the meantime, we need to be very careful. We need to pay attention to intonation as well. When I say intonation, the voice can go up and down when and if necessary, just like this. We must first address your nutrition, after which we can consider more invasive procedures. Appropriateness. When I say appropriateness, we try to use a language so that a suitable and appropriate language so that our patient can understand us easily. For example, here you would rephrase hypertension in the role player card to high blood pressure. You know what hypertension is, but we assume that our patient may not be familiar with the word hypertension, so that we say blood pressure. So your language and tone should also remain professional and confident, and you should adjust your tone to match the emotion of the patient and the topic being discussed. Resources of grammar and expression. I'm going to discuss the various options available to you. The first is, the second is, the third is, and then we tell the process. Or you can say, I'm going to talk about several possibilities you have. First is, second, finally, and you finish those possibilities. You finish talking about those possibilities. Relationship building. Initiate the interaction appropriately. Initiate means start. Interaction is the communication. We need to use an appropriate language. You can say, hello, doctor. Hello, sir. Hello, I'm Dr. Albert. Is it Margaret French? I'm one of the rheumatologists attached to the hospital. Your family doctor has asked me to see you about the joint problems you've been having. Or you can say, just this restated version you see here. I'm Dr. Albert, and is it Margaret French? I'm one of the rheumatologists working at the hospital. I'm being asked to visit you by your family doctor to discuss the joint issues you've been experiencing. We continue with relationship building. Let me just scroll down. Yeah. We need to demonstrate an attentive and respectful attitude. Here is an example. What I would like to do is spend a few minutes with you now discussing your symptoms. Is that okay? Please let me know if you're feeling uncomfortable at any time. Or, what I would like to do right now is to talk to you for a few minutes about your symptoms. Can I do that? At any point, if you feel uneasy, just let me know. Demonstrate a non-judgmental approach. So what worries you most is that the abdominal pain might be caused by cancer. I can understand you would want to get that checked out. Or we can say, therefore, the possibility that the stomach pain is cancer related is what scares you the most. I can see why you would want to have that examined. Show empathy. Here are two examples how we can show empathy. Just let me do it this way. Yeah. You mentioned earlier that you were concerned that you had angina. Angina is a very particular kind of pain which relates to several underlying conditions. Is it all right if I ask you a few more questions to rule out muscular pain? Or you can say, you previously said that you were worried you might have angina. Angina is a very particularly specific type of pain that has connections to various underlying medical issues. Would it be okay if I questioned you further to rule out any musculoskeletal pain? Here, and the next one is another example. I can see that your husband's memory loss has been very difficult for you to cope with. I imagine I would feel similarly if the same thing happened to me. Or you can say, I can understand how tough it has been for you to deal with your husband's memory loss. I imagine I would feel similarly if the same thing occurred to me. Understanding and incorporating the patient's perspective. Elicit and explore the patient's concern. When I say elicit and explore the patient's concern, I mean that you just ask questions and you try to get more information about the patient's concerns, how he feels or how she feels. For example, did you have any thoughts about what might be causing your symptoms? Was there anything particular you were concerned about? See, with these questions, you can get and you can explore the patient's concerns. Or you can use these structures. You mentioned that you were concerned about the effect the illness might have on your work. Could you tell me more about that? Another one, which is just a restated version of this sentence. Could you elaborate on your statement that you were worried about the potential impact your illness would have on your work? Pick up on patient cues and react accordingly. You use the word worried. Could you tell me more about what you're worried about? See, you pick up the word worried and then you want to get more information about that concern, about that worry. Could you elaborate on what you meant when you said you were worried? Here is another example. I sense that you're not happy with the explanations you've been giving in the past. Or you can say, I get the impression that the previous explanations were not satisfactory to you. Relate your explanations to the ideas, concerns, and expectations you have elicited from the patient. For example, as you say you're having trouble sleeping at the moment, let's talk about things that might help you address this before we move on. Or, since you mentioned that you are currently experiencing difficulty sleeping, let's talk about some strategies that can help you resolve this before we continue. Sequence the interview purposefully and logically. Since we haven't met before, it will help me to learn something about your past medical history. Can we do that now? So here, what am I doing? I'm just sequencing. I'm just putting things in an order. And as you see with this, can we do that now? I'm just informing the patient that we are starting another process. I'm asking you some questions and about your medical history. First, I inform and then get permission and reassure the patient with my question and let the patient speak. Given that we haven't met previously, it will be helpful for me to understand your prior medical history. Can we do that right now? Can we do that right away? See, with this, we try to sequence the interview purposefully and logically. Here are two more examples. You mentioned two areas there that are obviously important. First, the joint problems and the tiredness. And second, how you're going to cope with your kids. Could I start by just asking a few more questions about the joint pains? And then we can come back to your difficulties with the children. You addressed two very significant topics there. First, the joint issues and fatigue. And second, how you're going to handle your children. Could we just talk a little bit more about the joint pains to start? And then we can get back to your issues with the kids. Use organizing techniques in your explanations. For example, you can say, there are three important things I want to explain. Firstly, I want to tell you what I think is wrong. Secondly, what test we should do. And thirdly, what the treatment may be. I want to explain three crucial points. First, let me explain what I believe to be wrong. Then I will suggest certain testing. And finally, possible treatments. You can say, it's particularly important that you remember this. Or, it's crucial that you keep in mind this in particular. Crucial means important, significant. So just to recap, just like summarizing when you're telling your closing remarks, when you're just informing your patient that you're about to finish the conversation, you make a summary. So just to recap, we have decided to treat this as a fungal infection with a cream that you put on it twice a day for 2 weeks. And if it's not better by then, you are going to come back to see me. Or, just to review, these are the same. We have chosen to treat this as a fungal infection with a cream that you apply twice daily for 2 weeks. If it has not improved by then, you will return to my office. Facilitate the patient's narrative. Facilitate means make things easier. You can say, yeah, I see. Chest pain, you just try to make sure that you follow the patient, what patient says. Not coping, not handling, like this. Are you thinking that when John gets even more ill, you won't be strong enough to nurse him at home by yourself? You're just trying to make sure you understand what the patient is worried about, what his or her concerns. Are you worried you won't have the strength to care for John at home alone if his condition worsens? In order to facilitate the patient's narrative, we can also use these structures. Start at the beginning and take me through what has been happening. Or begin at the beginning and walk me through everything that has happened. How have you been feeling since your operation? Since your surgery, how have you been feeling? Tell me about your headaches. Describes your headaches to me. Or what makes your headaches better or worse? Why do your headaches improve or worsen exactly? Here, On tip number 7, information gathering, there is something we need to pay attention. We need to avoid compound questions and leading questions. I mean, don't do these during the exam. Have you ever had chest pain or felt short of breath? You can either ask, have you ever had chest pain, and finish here? Or you can ask, have you ever felt short of breath? Not a compound question, not a leading question. Or have you ever experienced shortness of breath? That's done. No more or chest pain. We need to ask one question at a time. Avoid asking these questions as well. You've lost weight, haven't you? Or you haven't had any ankle swelling. You can just ask, did you lose weight or have you lost weight? That will be enough. You have shed some pounds, don't you? You haven't seen any swelling in your ankles. This will be enough. You have shed some pounds, or have you shed some pounds? That will be enough. So avoid asking leading questions in your interview. Don't do these. Clarify statements that are vague or require amplification. For example, could you explain what you mean by lightheaded? Could you clarify what you mean by feeling dizzy? When you say dizzy, do you mean that the room seems to actually spin around? Or do you mean that the room actually seems to whirl around when you say you feel dizzy? So, by asking these questions, we are trying to clarify which are vague or when we require amplification. Summarize information to encourage the patient to correct or give more information. For example, can I just see if I've got this right? You've had indigestion before, but for the last few weeks, you've had increasing problems with a sharp pain at the front of your chest. This has been accompanied by wind and acid, and it's stopping you from sleeping. It's made worse by drink, and you were wondering if the painkillers were to blame. Is that right? Establish what the patient already knows. For example, it would be helpful for me to understand a little of what you already know about diabetes so that I can try to fill in any gaps for you. Or, it would be helpful for me to understand a little of what you already know about diabetes so that I can try to fill in any gaps for you. Here is another example. Based on your blood test results, we need to discuss ways to lower your cholesterol. What do you know about Lipitor? We need to talk about measures to lower your cholesterol based on the results of your blood test. What is your knowledge of Lipitor? Here is another tip. Pause periodically when giving information, using the patient's response to guide next steps. Here is an example. So really, given the symptoms you have described and the very typical way that you wheeze more after exercise and at night, I feel reasonably confident that what you're describing is asthma and we should consider ways we might treat it. How does that sound so far? Another example. Therefore, I'm quite certain that what you're describing is asthma and that we should consider ways to treat it. This is especially true given the symptoms you have described and the very usual way that you wheeze more after activity and at night. How does that sound so far? Encourage patients to contribute reactions and feelings. Here is an example. What questions does that leave you with? Have you any concerns about what I have said? What reservations do you have about what I said? What questions does that raise for you? Check that the patient has understood. I know I've given you a lot of information today, and I'm concerned that I might not have made it very clear. It would help me if you repeated back to me what we have discussed so far, so I can make sure we are on the same track. Discover what further information the patient needs. You can ask these questions. Are there any other questions you'd like me to answer or any points I haven't covered? Or do you have any more questions or concerns that I haven't addressed? So, I've tried to show you some tips on speaking subtest. Thanks for watching.